Thank you, sir. Welcome to our stream here. Professor Dr. Vikas Bhatia, the founder executive director of AIMS Bibinagar, is going to tell us about the way forward from this situation. So now, sir, please.
Okay, thank you very much. I hope I am audible and visible to the audience and the
Yes, sir.
participants.
Yes, yes, sir.
Right, thank you very much. Thank you very much. First of all, my mm, good wishes to all my friends, my colleagues, Indian Public Health Association for organizing this wonderful webinar at a time when we are having a real big challenge in our lives. The entire world is going through a big challenge. Uh, to the President of the IPHA, Dr. Sanjay Rai, Secretary General, Dr. Sangamitra Ghosh, my co-speakers, we from the economics, and Professor Bharadwaj, who spoke on various health issues, health inequalities existing at this moment globally, and talking in context of the COVID. Uh, I have been asked to say something about what can be done and what's the way forward, what's the way forward. Uh, on this time, when we are talking about the theme, that's the building a fairer and healthier world for everyone. So we want to provide a world which reduces the inequalities, which is fair in terms of giving opportunities to every human being on the in the existing in the universe. But somehow we have observed through the data which has been projected, which have been shown, there are various inequalities in terms of various situations, whether they are related with the gender, or it is because of the social factors, economic factors, or within the world, if we see the reasons, the rich countries versus the poor nations, and within the India also we see the difference within the states. One state is so different from another one, and within the states there are different communities. There are some communities who do not have access to the health care, who do not have access to the various other opportunities. There are a lot of underprivileged communities. Then there are inequalities between the within any city. Even if you say any big city, there is a rural population, there are slums. Then we have the rural population where the primary health care is not up to the level. There are inequalities. If we look at the educational levels, the people with the lower literacy have the poor access and poor understanding, and are unable to understand what actions have to be taken, particularly during the COVID time. So we see that the world is divided between haves and have-nots. That's what has COVID done, of bigger divide. If we see what has happened yesterday in India, 1.15 lakh people got new infections just in one day, which is the highest ever recorded in our country. The last time we had was close to the 97,000 or 98,000, somewhere in the mid of the September, and we were very hopeful and optimistic the way it was further going down with all the hard work of the frontline workers, the healthcare workers, and so many people who participated in this war. Uh, but unfortunately, we are again going through a more critical situation. And at this time, we have 1.28 active cases currently. Yesterday, we were 1.28 cases who are 8.5 lakh cases who are still very active, who have the COVID. So far, 1.28 crore people in India have suffered from this disease. And unfortunately, 70% of the deaths are occurring in the individuals who have comorbidities. This is how the government decided that when the intervention, when the time has come to provide the vaccination, it started with the frontline workers because they were the one who were exposed the most, and subsequently the elderly people because they were having comorbidities and they were the highest risk, and subsequently we know that the priority was given to the 45 with comorbidities. There is a big list of most of them were non-communicable diseases like diabetes, hypertension, and various cardiovascular diseases and cancers. And this is how it has happened. The good news is that we have something to look forward to. So far, we have vaccinated 8.7 crore people. And if we add, yesterday we vaccinated about 33 lakh people in our country, among the highest in the world. So possibly we will be touching 9 crores today by the time we sleep. Dr. Bhardwaj mentioned about the happiness. His Holiness Dalai Lama ji said that the best form of the health is happiness. That's what everybody wants to strive. Nobody wants to cry. Nobody wants to see the pain and sorrow. But unfortunately, this COVID vaccine, this COVID pandemic has created such a big divide. From the first theme, World Health Day, we started in 1950. So many, about 70 years back, uh, we have been celebrating World Health Day on various aspects, various issues. And if we look at the various things which has emerged over the years, in last 30, 40 years, in the beginning, there were too many on the infections, and then they moved on to various universal health coverage, to the non-communicable diseases, and mental health, depression, and all that's happening. Today, we are talking about building a world which is equal, where everybody has equal opportunity to smile and be happy and healthy in this world. But this COVID has really turned the situation. Now, if we look at the situation in the country, our country, I just think the first speaker, our madam, was talking about the Kerala situation, and if we compare the situation, look at the with the best state in the country, and among the poor states or the poor performing indicators, if we say just compare one state with another, the net NMR is 3.4 and it is 34.5 per, uh, uh, in Bihar. If we say infant mortality rate, it is 4.4. In Kerala, it is 46.8. And if we see the under 5 mortality, it is 5.2 and it is 56.4 in Bihar, which means that a child who is born in Kerala and one who is born in Bihar has 10 times more chances of dying. So that's the inequality which is existing within our country. So we are already in a situation where the indicators these themselves reflect that our country is having two kinds of the population. There is a population which has a better chance of survival. There is there is another population which has a less chance of survival. Now, if we look at what has happened because of the COVID, and what was the situation in 2019 and what's happened in 2020, I will show you one graph which you can see that in 2019, if it was presumed that if there was no COVID, then this green indicates that these are the people who are not poor, non-poor people. And the red one indicates that these are the people who are the poor. Okay, now what has happened? Because of the various interventions, various programs of the government worldwide, this would have reduced. This red one would have become brown. That's what is written as C. And the B is one who would have come out of the non-poverty to the non-poverty zone. However, because of the COVID, we can see that B is further added, which otherwise would have become non-poor. However, because of the corona, it has led to so much of poverty. It has added not only B, it has also added C. So the people who are there, in the C, in the D, the number of people who are non-poor is further shrink. So this is the situation which has happened throughout the world. Now, we know that the impact of the economic impact, the impact on the human resource, on the human development is going to be enormous. And the as such, our country is already at the 131 position in terms of the human, development index. And in comparison to the countries like Norway, where the HDI is 0.957 and we are 0.645, it is because our life expectancy, our health, our education, our per capita income is less. Now, this is what is basically three major things which divide between one human being, the development of one human being, and the development of the another human being. Now, what to do? Now that we have listened to our speakers, that the inequality in terms of various issues, whether it's a drinking water, it is sanitation, or it is housing, it is food, it is employment, it is the schools and education, it is the deliveries, it is the surgeries which have to be performed in the hospitals. All that has been have been compromised. And the compromise is of very alarming in nature. So this is the situation, and and we see that the government of India was working hard right in the last few years to reduce this inequality, and we were even praised by the World Bank that our country, because of the various interventions, has been able to convert non-poors into poors into the non-poor zones. Now, all this effort has taken us back. We cannot forget what has happened during the lockdown period in our country, which further reduced, which led to the economic recession and worldwide. And whether it's a rich country or it's a poor country, and we have further been shrink, and our economies have been reduced to such a situation where entire money is now being a lot of money is being spent on management of the COVID, and the generation of the income has reduced enormously. Now, the aims which were being created, because I am in aims, I'm just giving you one example that government of India, one of the objectives, if you read, was to reduce the regional imbalance in providing the good quality healthcare to the people. Now, when I looked at the aims Bhubaneswar, I found that the poor people were the one who were really being benefited because they didn't have the money to go to the aims daily. They were very happy that they could come to the hospital and where the BPL were given, near free treatment. Now, the entire hospitals, the entire wards were converted into the COVID wards, and they all were full of those patients, and that is what was happening. So the patient care, the health care have really been compromised because of the COVID. Now, the situation is such that how to react and how to come back and how to respond to this. We see the situation in some of the countries who have done really well. They are good practices. They are good models. They are nations. I was just listening to the today's situation in USA. You all know that United States of America was having one of the highest number of cases, is having very high morbidity, but the president Biden was telling that they were planning to see that the entire population of USA will be vaccinated by the mid of May. However, he was very pleased to inform today that this has further been preponed, and possibly by the middle of the April, in next few weeks, few days, the almost the entire population will be vaccinated. Now, at the same time, Dr. Bhardwaj mentioned that 129 countries, they have yet to see the COVID vaccine. We are somewhere in the middle. We are fortunate that we are well known in the world as a, you know, one who has a very good pharmaceutical sport. We are the capital of the pharmacy, and we have produced the COVID vaccine as our own indigenous vaccine in Hyderabad. Now I am in Hyderabad at the moment, and we also have our manufacturing the Covishield, which is also being produced by the CM Institute. Now we have a very difficult situation. We have the commitment with the WHO that we have to provide certain amount of vaccines so that the poor nations they also get vaccinated, the populations they can be saved. At the same time, we have seen the return and the second wave of the COVID, and we also have a huge population which is to be vaccinated. Now, what to do? Now, the government is rethinking what to do. It has been providing vaccines to various nations under the vaccine Matri program. Now, there is rethinking because, like we see in Maharashtra, which is having such a huge burden of the vaccine, requirement of the vaccine, and so is the population. And their voices yesterday we heard from the IMA. They have been telling that all the population, entire population above 18 should be vaccinated. And the data which is coming emerging now today, we see that a large population is in the younger age group between the 20 to 40 years is getting infection because of the COVID, because of the mutation. And epidemiologically, we know that when the measles was introduced and when the large population was vaccinated, then there was a shift in the age. It was because the virus is also looking for its survival. It shifted from the very young age, from infants to under 5 to the higher age groups. Possibly when we are vaccinating to the elderly people to 45 plus, now as more and more people get vaccinated, there is a possibility that the virus, the mutant virus, or maybe the different types of virus might be affecting more the younger population. So we need to look at the universal approach and see that how we can improve our production line, how the supply can be reached. Is a big responsibility, is a big commitment because we are a big nation and we have to vaccinate. Now, the various national health programs which are introduced, most of them we already know are in the beginning were addressing the communicable diseases, but with the emergence of the non-communicable diseases, a lot of newer programs came up, including the National Mental Health Program, which is now very important, very relevant, because we knew that one of the leading cause or maybe the number one cause in upcoming years would have been the depression even without COVID. But COVID has further added to the mental health issues. And we know with the loss of jobs, with the shrinking of the of the economy, with the students sitting at homes, the people are sitting working from home. It is the travel has been banned. People cannot travel. People cannot move, and this is really leading to a very big mental health issue. We really need to focus on this one big aspect. We also need to look at the aspects where we can improve our fitness in general, because the obesity, which is leading to the non-communicable diseases, which becomes the comorbidity, one big risk factor for the causation and the mortality in the COVIDs. We have to address that. We look at the Ayush, look at the yoga, we look at the fitness, we also look at the meditation. We are rich in our culture, and we have to go back. So we have to we have to develop these things, so that we are able to bring those things. Uh, Now that the health system is really overstretched, because the doctors, the nurses, the hospitals, the primary health care, they all are engaged in the COVID related activities. The little window which we got of hope, we were able to reach out to for various other activities for about 2, 3 months, but somehow we are coming back to the situation where we have to focus totally on this. Somebody was telling that all the hospitals are fully, there are no beds. A private hospital are full, the government hospital, even we over here also, because we are the new institution. We are working to create 80-bedded COVID care center. We are providing all the, we have started the vaccination here and also, but the situation seems to be quite, you know, but we have to fight this. We have to win this war. And the important aspects are that what we listen to the health budget recently, released by the government of India. There has been increase in the budget. The government of India has been talking about One Health, where the laboratories, the public health system has to be strengthened, where there has to be the integration of the Ayush with the modern system, and where there is the increased requirement in the country of the all the types of the cadres, whether they are doctors, they are the specialists, there are we have the nursing officers, we have the paramedics, we have the other staff which are supporting. So we need to see that every institution, and that's what we also heard, that a paramedical act has also been passed in the parliament recently, just a few days back. So all these things really need attention. So we need to have a good public health system. And we, as a Indian Public Health Association, has a very big responsibility. We are a huge family, and we all are skilled, trained, and we can really contribute. We can really support the entire country in different ways. Uh, and we have to respond. And this is the time that we all come forward, and we provide the technical support, we provide the managerial support, we provide the logistics support. Maybe we can also provide the economic and financial support also. Uh, the health reforms now are really required, and the government is already working on this because we are already short of the health professionals in the country. And this government has already been working on increasing the number of doctors, creating more and more institutions, medical colleges, more and more aims. And this is how the efforts have been made so that more and more people are available in the close to the community. Now, these are the various aspects which I feel we need to really look at it. The nutrition, the undernutrition, and the NCDs because of the overnutrition, obesity. All those programs have to be, uh, implemented in Latin spirit as and when we get an opportunity. We see that we are able to reach to the people. COVID had taught us many things. In as a public health professional, we all appreciate that we have been telling in the schools that please wash your hands. That will reduce the infections. That will reduce the infestations. But we know that how the sanitation was being followed. What was the situation? Now, COVID has taught in a very short period everybody that how we can, wash your hands. Everybody knows people are taking precautions. People have been using masks of late. Of course, the COVID appropriate behavior has been not been followed at many places. Now, what we have is three things. One is that the COVID vaccination, which was not there a few months back. See, vaccination has to reach, and there should not be any vaccine hesitancy. People should be taught about this. People should be told about this. And now, gradually, out of fear, people are coming now. But people need to understand. We need to educate to the people. We have been doing it. We have seen our advocacy. We have seen our team leaders. We have seen our ministers. We have seen our leaders all coming forward, taking vaccines, and we are encouraging people to come forward. And now we are talking about the vaccine shortage at times. So now people are very, very keen in getting vaccinated. Now, the people who get affected the most are the poor people because at times we are not able to reach to them. And so we need to see that the primary health care also responds to them appropriately. The second thing which we really look at is that the preventive in nature, which vaccine also is kind of is an important vaccination is also a preventive measure. The second aspect as a public health professional is the COVID appropriate behavior, the mask, hand washing and sanitization, talking to people, creating more and more awareness. And I really wish over televisions, our media, and newspapers, advertisements, they all should talk about this COVID appropriate behavior. Having the lockdowns and reducing those opportunities definitely impacts, creates further economic inequalities and further shrinks our GDP and reduces and increases the poverty. The government is very cautious, but as and when it is required, that might be the need of the hour. But at times we maybe to ensure that people don't go to the overcrowded places, people don't go to gym, the restaurants, and take all the precautions which we have been doing. We have proved it. We have demonstrated it with that when we all are together, we work together, we have shown results. And at a time we were just having 12,000 cases. We were really coming down to that, even 9,000, 10,000 cases in a day. So we have to come back to that. We need to understand. The third thing is that the health system, the ICUs, the equipments, the drugs, the medicines, and we need to have a strong mental makeup now because there is kind of a COVID fatigue which is come emerging among various cadres, various people, and people have started taking things lightly. It's not like that. We have to be responsible. We have to be ensuring that people have trust in our on us, and we are able to reach them, and we are able to save lives. So the various other interventions which will are like national programs, the ICDS, the women empowerment, the housing, the sanitation, the drinking water, all that, the results take time. What we need to do is ensuring that everybody gets vaccinated. We need to see that we have a good number of hospital beds and we have oxygen, we have ICUs, we have been able to isolate patients, we have to teach them, we have to see that all that is followed. And third is that immediate action is that we follow the COVID appropriate behavior. This is what I felt from my side that uh, we should be very cautious, very careful, and listen to the guidelines being issued by the government, and we strictly follow them. We have a big responsibility. We have to win this war. There is no other option. We don't want many people to be lost. We have lost many doctors. We have lost our own friends. We have lost a lot of people in our communities. So please let's work as together as a team. That is my message as IPHA. My request and my urge to the office bearers to please come forward, and we all as members uh, come forward, and we have to support the system. We have to support the government. Thank you very much. Namaskar.